Do you have unexplained muscle or joint pain? The culprit might be hiding in an unexpected place, your thyroid gland. In this video, we'll expose 8 weird signs that could indicate an underlying thyroid disorder, empowering you to recognize potential issues early on. 1. Changes in your hair and skin. If you've noticed some funky changes to your hair and skin lately, your thyroid might be the culprit behind these cosmetic curveballs. This tiny gland plays a huge role in keeping your hair and skin looking and feeling their best. A study published in the Journal of Clinical Endocrinology and Metabolism highlights how hypothyroidism, a condition characterized by low thyroid hormone levels, can negatively impact your hair and skin. Individuals with hypothyroidism often experience symptoms like excessive hair shedding, hair brittleness, and alterations in hair texture or color due to the body's inability to properly grow and maintain healthy hair. And it's not just your hair at risk. Scaly, perpetually dry skin is another telltale sign of thyroid troubles. Without those vital hormones, your skin can't retain moisture well or maintain its soft, elastic quality. If you've been battling mysterious dryness and roughness, no matter how much lotion you slather on, don't just write it off as a skincare fail. These hair and skin issues could be an outward signal that something's amiss with your thyroid on the inside. Seeking medical evaluation is critical to pinpointing the root cause and getting the right treatment plan before permanent damage occurs. 2. Sudden changes in mood and mental health. If your emotional state has been a roller coaster ride lately, with debilitating lows and frenetic highs, don't just chalk it up to life's stresses. Your thyroid could be the reason behind those unruly mood swings and mental fogginess. You see, when your thyroid hormones run low, it can trigger a natural sluggishness of the mind. We're talking persistent sadness, lack of motivation, and even issues with memory and concentration that mimic dementia. A scary thought, but leaving this thyroid disorder unchecked could potentially increase your risk of developing dementia down the road. Conversely, an overactive thyroid pumping out too many hormones can frazzle your nerves. Intense anxiety, irritability, restlessness. It's like your body's stuck in perpetual fight or flight mode. Some even experience full-blown panic attacks as those thyroid levels go haywire. Don't ignore these emotional turbulences as just stress. If left unchecked, thyroid imbalances can seriously derail your mental health and well-being over time. 3. Temperature sensitivity. Ever feel like you can't get comfortable no matter how much you crank the heat or blast the AC? Your thyroid might be the real thermostat gone haywire. The thyroid gland plays a pivotal role in regulating your body's internal temperature through its influence on metabolism. With hypothyroidism, not enough thyroid hormones means your metabolic furnace runs low, leaving you constantly shivering and sensitive to the slightest chill. Basically, your body struggles to generate sufficient warmth to keep you cozy. The opposite scenario is true for hyperthyroidism. An overactive thyroid puts that metabolic motor into overdrive. You're forever feeling flushed, sweaty, and overheated as your revved-up metabolism has difficulty dispelling all that excess heat productively. More than just a comfort issue, these hot and cold extremes signify your thyroid's deep involvement in energy expenditure. The hormones also directly impact heat-producing brown fat stores meant to keep you warm. So pay attention if you can't seem to find your thermal sweet spot. It may be a red flag that your thyroid needs professional temperature regulation. Before we move on, please take a moment to subscribe to the channel and hit the bell icon. If you find our videos helpful, please support us by dropping your comments in the comment section. 4. Unexplained weight changes. Have you noticed your weight fluctuating significantly despite maintaining a consistent diet and exercise routine? It might be too quick to attribute this to a lack of discipline. In fact, your thyroid could be the underlying factor affecting your metabolism. You see, this gland acts as a master controller of your metabolism and how efficiently your body burns calories. When thyroid hormones run low in hypothyroidism, it halts your metabolic rate, making it feel like you've hit a permanent weight loss plateau no matter your calorie deficit. Conversely, an overactive thyroid can crank your metabolism into overdrive, leading to sudden, unintentional weight loss, as your body struggles to keep up with its accelerated energy expenditure. It's a cruel double whammy. You're losing weight despite feeling constantly hungry and fatigued. But that's not all. New research suggests this relationship could be bidirectional, with obesity itself potentially triggering thyroid disruptions in a vicious cycle. If you're experiencing unexplained weight fluctuations, it's worth getting your thyroid levels checked. 5. Muscle weakness and joint pain. If climbing a simple flight of stairs leaves you winded and your muscles screaming, your underactive thyroid might be the culprit behind that debilitating weakness. And that's not all. Nagging joint pains that just won't quit could also be a surprising side effect of hypothyroidism. You see, thyroid hormones play a crucial role in both muscle health and joint function, so when levels dip too low, it can leave you feeling achy, stiff, and like you've aged decades overnight. On the muscle front, hypothyroidism can trigger cramps, tenderness, and overall loss of strength as the vital hormones struggle to facilitate repair and recovery. Without enough thyroid oomph, your muscles can't bounce back correctly from the everyday strains we put them through. The result? A constant baseline of soreness and fatigue that makes basic physical tasks feel insurmountable. But it's not just your muscles that suffer. Hypothyroidism can also seriously impact joint health, especially in areas like the knees, hands, and feet. As thyroid levels plummet, soft tissues become inflamed, and lubricating joint fluids dry up, leaving bones grinding painfully against each other with every movement. For some, this rigid agony even progresses into debilitating conditions like carpal tunnel syndrome. The good news? Properly treating underlying hypothyroidism with synthetic thyroid hormone replacements can help alleviate these musculoskeletal symptoms over time as levels stabilize. However, if muscle and joint issues persist despite optimized treatment, it's essential to contact your doctor to investigate other potential causes, like arthritic conditions. Don't ignore that bone-deep exhaustion and soreness. Your thyroid may be waving a red flag. 6. Gastrointestinal issues. If you've recently been facing significant digestive issues, ranging from diarrhea to constipation and everything in between, it's possible that your thyroid is the unexpected cause behind these problems. This gland greatly regulates gut motility, how quickly food moves through your digestive tract. With hypothyroidism, not enough thyroid hormones means that gut transit grinds to a slow pace. You're left feeling bloated and backed up as your intestines struggle to keep things moving along smoothly. Constipation becomes the insufferable norm. But flip that coin and hypothyroidism offers its own unique intestinal miseries. An overactive thyroid can overstimulate those intestinal contractions, causing food and waste to rush through your system too quickly. You just can't seem to keep anything down as diarrhea becomes an uncomfortable fact of life. More than just unpleasant, these accelerated bowel issues can seriously hamper your body's ability to absorb nutrients properly from your meals. This doesn't stop there either. New research shows that thyroid disorders can actually disrupt your gut microbiome, the community of healthy bacteria that keeps your entire digestive system humming along. With an imbalance of these microorganisms, you're more prone to issues like gas, bloating, and even immune system dysregulation. If you're dealing with ongoing and troublesome gastrointestinal symptoms, it's important not to simply attribute it to your diet. Consulting your doctor to examine your thyroid levels might uncover a hormonal imbalance that requires attention to prevent further impact on your digestive health. 7. Menstrual changes and fertility issues. For women, an out-of-whack thyroid can throw a serious wrench into reproductive health and fertility. Hypothyroidism, in particular, is linked to an array of menstrual miseries, from delayed periods during puberty to excruciating cramps, heavy bleeding, and irregular cycles in adulthood. But the ripple effects go far beyond just period woes. You see, thyroid hormones are utterly essential for keeping your entire reproductive system running smoothly. They help orchestrate the delicate dance of ovulation each month by signaling the right hormones at the precise times. When thyroid levels dip too low, that ovulation process gets disrupted, making it exponentially harder to conceive. In fact, untreated hypothyroidism can increase the risk of infertility, miscarriages, and even complications during pregnancy, such as premature birth or birth defects. And it's not just an underactive thyroid that can jeopardize your family plans. Even slight overactive thyroid imbalances may lead to irregular periods and ovarian cyst formations that can impair fertility down the line. Don't brush off menstrual irregularities or difficulties conceiving as something to just tough through. Getting your thyroid levels checked should be a top priority. 8. High cholesterol levels. When your thyroid malfunctions, it can significantly affect your heart health over time. Hypothyroidism especially can lead to increased levels of bad cholesterol, creating a risk for severe conditions such as heart attacks and strokes. The deficiency in thyroid hormones means your body struggles to process and clear LDL cholesterol, allowing it to accumulate in your arteries. This can result in the arteries becoming blocked with plaque deposits, posing a serious threat to your health. Now, having an underactive thyroid alone doesn't necessarily condemn you to heart disease. But leaving hyperthyroid-induced high cholesterol unchecked essentially rolls out the red carpet for cardiac catastrophes. That's why promptly treating thyroid dysfunction with hormone replacement is so crucial. By optimizing those hormone levels, your body can more effectively manage cholesterol and minimize its artery-clogging antics. Of course, partnering that thyroid treatment with other heart-smart habits like a nutritious diet and exercise routine remains essential for knocking down cholesterol to safer zones. Don't let thyroid disorders silently set you up for cardiovascular disasters. Getting those levels dialed in could be a literal lifesaver. Now, while managing thyroid disorders requires medical treatment, adopting certain lifestyle adjustments can provide valuable support and reinforcement. And luck for you, we're here to give you some easy-to-follow tips that can make a difference, starting with 1. Schedule regular thyroid screenings. If you're at higher risk for thyroid issues due to factors like family history or autoimmune diseases, it's vital to have regular checkups. Early detection of thyroid imbalances through thyroid function tests can significantly improve the effectiveness of your treatment. 2. Balance your iodine intake. Consume a diet that provides an adequate amount of iodine, avoiding both deficiency and excess. Include iodine-rich foods such as seafood, dairy products, eggs, and iodized salt in your meals. Iodine is essential for the production of thyroid hormones. 3. Incorporate stress management techniques. Utilize stress reduction methods such as meditation, deep breathing exercises, or yoga to maintain a healthy balance. Chronic stress can impair the communication between your thyroid and brain, affecting hormone production and regulation. 4. Eat a nutrient-rich diet. Adopt a diet filled with anti-inflammatory foods and antioxidants. Eat a variety of colorful fruits and vegetables and ensure you're getting enough selenium, found in Brazil nuts, zinc, available in oysters and beef, and omega-3 fatty acids, present in fatty fish. These nutrients support thyroid health. 5. Engage in regular, low-impact exercise. Incorporate gentle, low-impact physical activities into your routine. Regular exercise supports metabolism, aids in weight management, reduces stress, and improves sleep quality. All these factors are beneficial for thyroid health. Tackling thyroid issues requires a multifaceted approach, blending medical treatment with proactive lifestyle changes. These simple strategies can optimize your body's environment for better hormone balance. Now, if any of these bizarre signs resonate with your own experiences, don't hesitate to consult a healthcare provider and get your thyroid levels adequately evaluated. Recognizing these obscure clues could be the key to restoring your hormonal balance and overall well-being. Talking about restoring hormonal imbalance, don't forget to check out our next video where we'll explore the 8 essential vitamins and minerals your body really needs.